Hello and welcome. My name is Dr. Gorica Micic. I'm a clinical psychologist and I'm here with Professor Leon Lack, who is a professor of psychology and sleep. And we're here at the Adelaide Institute for Sleep Health at Flinders University. We're in our clinic, in our lab, and we're here to talk to you a little bit about insomnia and about sleep difficulties. How do you feel about answering some questions, Leon?
Give it a go.
So tell me, is insomnia a common problem?
Oh, yes, it is. It is, Gorica.
Yeah. And are there different types of insomnia?
Well, that's important. There are different types of insomnia. It's important to know that.
All right, let's pick up on that a little bit after. So last question is, if people have followed the usual sleep hygiene advice to no avail, can they still be cured of insomnia?
Yes, indeed. There's a very good cure for insomnia.
So let's get into sort of the nitty-gritty, talk a little bit more in detail about some of these questions and provide some feedback to people about how they can manage their insomnia.
Yeah, Gorica, let me ask you, what is insomnia exactly? What does it consist of? The term is thrown around a lot, but can you give us a short answer?
Absolutely, yeah. So a lot of people tend to think that insomnia is just inability to sleep, which it's not really. It's characterized by difficulties falling asleep or maintaining sleep throughout the night, or some people have difficulties with waking up too early and not being able to fall back asleep. Really, it's the symptoms that we experience during the day that we feel the most, which are often irritabilities, issues with our mood, with our concentration or thinking, and just feeling low, not feeling at our best, really. And often with that, we start to get implications on our mental health, like anxiety or depression and things like that over the course of the insomnia as well. You spoke before about insomnia being quite common as well. Can you elaborate a little bit about how common insomnia is?
Yeah, okay, let's be more specific. Usually people talk in terms of percentage of population having something, and it is the case that a large percentage of the population has bouts of insomnia across the year. Maybe as much as 30 or 40% will experience some difficulties with their sleep for short periods of time, and that usually resolves. But if we talk about chronic insomnia, people who have problems several times a week throughout the year, getting sleep and so forth, and the daytime symptoms associated with that, we're talking about at least 10% of the population, maybe 10 to 15%, depending on how tightly you define it. But that affects a large number of people. So it is quite common in Australia. It will be affecting 2 or 3 million people.
It's a very, very common sleep disorder.
You said something about anxiety and depression being associated quite often with insomnia, and you can understand if you have this big psychological burden of insomnia, how it can get you down. Could you elaborate a little bit on the relationship to these mental health problems?
Absolutely. So, oftentimes I think people think that insomnia or sleep difficulties are secondary to these things, that often if we are stressed or if we're worried about something or if we're feeling a little bit depressed, that it's sort of a symptom, that insomnia is a bit of a symptom of all of these things, so that it can kind of be ignored and let's just focus on the actual presentation to try and hopefully then resolve the insomnia. But we do know now that it's bidirectional, which means that mental health problems can cause insomnia, but insomnia can also lead to anxiety and depression and things as well. So it shouldn't be dismerited, and we should really look at the whole picture, and actually in some cases resolving the sleep first may be more beneficial. So if we actually treat the sleep, we can start to see improvements in our mood, we can start to see improvements in our energy levels and ability to tackle the other problems or the worries or the stresses that we have. So it shouldn't be seen as a shadow of a different problem. We should really be looking at both, and in some cases maybe addressing the insomnia first to get the wheel spinning in a sense in terms of treating the overall picture. In terms of that, I suppose when we're talking about insomnia and treatment of both mental health disorders and insomnia, can you tell us a little bit about what insomnia treatment is and what it looks like?
Well, it's need to make it clear that there's a very good treatment for insomnia. It's called cognitive behavior therapy for insomnia, or CBTI, and it includes both behavioral adjustments in people's lives and cognitive adjustments, attitudes and knowledge about sleep and everything are all very helpful in overcoming some of the contributors to the insomnia. It's a non-drug treatment, and but it has long-term beneficial effects. So the treatment might take a few weeks to carry out, but in the long term, the person's basically cured of the insomnia. So a very large percentage of people treated with CBTI show very significant improvements, and those improvements are maintained. And part of the beauty of it is that they learn some of the procedures themselves, so they can have control over correcting any relapse they might experience later on. If they do, they know what to do to, again, treat their insomnia. So CBTI is the preferred treatment for insomnia.
So it's kind of a more potent pill, but it just takes a little bit longer, doesn't it? With, medications, yes, we could take them, but it's a Band-Aid cure, really, short term, and once the Band-Aid's off, the problem's still there underneath. But with CBTI, yes, it's a sort of a slower release pill in a sense. It takes longer to work, but the lasting effects are certainly there for a longer period of time, aren't they? Yeah. So I suppose wrapping up a little bit, what do you think the main takeaway messages are from all of this?
For how to sleep better, you mean, or?
From what we've discussed, really. What do you think the audience should be ignoring?
So insomnia is a common problem. It affects a large percentage of the population. There is a good treatment for it called cognitive behavior therapy for insomnia. And people ought to feel confident that there is a non-drug treatment for insomnia.
Excellent, yeah. And what about your sleep? What's that like? And yeah, go for it.
Well, I, put myself into a relaxed and comfortable sort of sleeping environment, minimal distractions. I look forward to it every night, but I don't go to bed too early. Even if I have to get up early in the morning, going to bed too early might mean that you're just lying there awake trying to fall asleep, because our sleep is controlled by our body clock, and our body clock might not be ready for sleep yet. So you need to wait until you're feeling noticeably sleepy, but try to make that about the same time every night. But most importantly, getting up at about the same time every morning. So avoid those long sleep-ins on the weekend. Not a good idea. So try to maintain a relatively regular sleep period in bed, in which you're going to sleep for most of the time you're in bed. Try to avoid obvious distractions like arguments with your bed partner, working on your computer. Those things then mess up the association of the bed with sleep.
Insomniacs as well, a lot of them spend a lot of time in bed as well. So yes, they keep their wake-up times regular and their bedtimes, but they also tend to kind of compensate, spend a little bit more time in bed because they're worried about the poor sleep. So, actually thinking about how much sleep we need and spending the amount of time that we do need is important, isn't it?
Yeah, that was the point I'm making. But, sleep affects individuals very differently. So what's your sleep like, and how do you prepare for bed?
Yeah, and I suppose that's another thing to consider, is that across the lifespan it's very different as well, because my sleep at the moment is a little bit different than what it might have been a few months back. So at the moment, being pregnant, I tend to be falling asleep a little bit earlier. I tend to, generally speaking, we at home have our lights dim and sort of, like you say, tend to avoid all the stimulants before bed. So it's quite a sleep-conducing environment for also our toddler that we have at home. So it generally means I'm sometimes falling asleep a little bit too early. So I'm actually noticing I'm waking a little bit more in the night as well. Both because of that and because of this. So sleep is a little bit different at the moment, but I don't get too fazed by it. I know it's just a phase at the moment, and I'm still feeling fine throughout the day. So generally speaking, it's kind of just a temporary phase at the moment, and I can very well see how people with insomnia start to get worried about their sleep, because when you do start to experience those awakenings in the night, throughout the night, it can be a pretty dreadful feeling, and you worry about how you're going to cope with everything throughout the day, but it does definitely create a bigger burden for us. So,
well, good luck with it all.
Thank you very much. It's been great chatting with you. It's hopefully been quite useful for the audience as well to grab some information out of this. So thank you guys all for listening, and thank you, Leon, for sharing some fantastic information.
Thank you, Gorica.